My name is Ben,
Hey guys, I'm Drew.
Hey guys, my name is Melson.
Joe.
and our master's project is Sex as an ADL.
Not
In the beginning, it was a bit uncomfortable for me just thinking about sex as an ADL, but we found that the more that we got into the research, and the evidence suggests that it's pretty much uncomfortable for quite a few people, but it is a very important ADL, and it shouldn't be left out. And we're going to talk about the various group dynamics and the process that we went through in order for us to get to where we're at right now.
Yeah, our group process was a little bit difficult working with four people, but we kind of started to pull everything together. We had a lot of help from our professors and everything, so that was great. But what we're going to do with this video is we're actually going to talk about the different parts of our project. Molson's going to start off with giving an introduction about sexuality in general, why it's so important to the different populations that we're looking at, and then I'm going to get into what are some of the findings, like do people with disabilities still require that kind of sexual ADL treatment. Then Ben is going to talk a little bit about why occupational therapists aren't addressing it, and then Joe's going to finish up, talk about our methods.
Occupational therapists play a major role in addressing sexuality as an ADL. Sex is an important part of life. From a young age, and even in the elderly population, where a direct link between intimacy among partners show not only sexual satisfaction, but overall life satisfaction as well. Sexuality is also important for individuals with disabilities. The care for partners of illness survivors go neglected. Being intimate can also be done in different ways without being sexual.
So as occupational therapists, we generally focus on occupations, obviously. One of the main areas of occupations that we focus on are ADLs. Now ADLs are very important because it's a good starting point, because you need to be able to do some of your basic ADLs, or at least have them done by others in order to engage in other occupations. So it's kind of like the starting point. Now, while occupational therapists do focus on a lot of ADLs, they leave out one of the major ones, which is sexuality. Now, as Molson stated earlier, sexuality is very important, not only to the population without disabilities, but also to the population with disabilities. It doesn't change just because all of a sudden you get a spinal cord injury or a neuromuscular disease. Now, according to research, we still see that sexuality is very important to many different clients, such as stroke survivors, individuals with neuromuscular diseases, geriatric patients. It's still very important, and the research shows that, but occupational therapists aren't really addressing it. And next, Ben is going to get into some of the reasons why, and also what we plan to do in order to get a better understanding as to the why.
As Drew just mentioned, sex is a very important ADL, but unfortunately, OTs are not addressing it. Based on the research that we've done, looking back in the days, it was a topic that was quite taboo, and unfortunately, it's still a topic that's quite taboo, both on the side of the patients as well as on the side of the therapists. From the side of the therapist, we found that in education, it's something that not necessarily overlooked, but unfortunately it's not really given the same level of importance as the other ADLs. So we found that, for the most part, the other ADLs such as grooming, dressing, bathing, and some of the other ones obviously that are important that we do on a daily basis, that they are covered throughout the curriculum, but unfortunately there's probably just a pretty small segment in a one semester period that's allotted to sex as an ADL, and that is supposed to be somewhat of the foundation that an OT would have going into practice. So what we're hoping to uncover is that maybe there's something to do with the demographics of the individual, maybe there's a lack of education, or just overall discomfort when it comes to addressing or approaching sex as an ADL. We found that there are several models that are out there, like the implicit model, to help OTs engage in discussing sex as an ADL. But if you're not comfortable discussing something, obviously, it doesn't matter how many models you have, we're going to find that it's pretty difficult. So we actually thought as a group that we'd be looking at the demographics of the OT. So demographics from the standpoint of maybe religion plays a role into it, maybe there are some other parts of the demographics, maybe gender, whether male or female, will play a role into it as to the level of comfort of the occupational therapist. We're pretty excited about the research in a sense that it will help to build on overall knowledge about this subject matter, and how do we continue to build on that so that we allow OTs to have more resources, or even build upon the tools that we currently have to enable them to make this ADL an ADL that has a bit more emphasis, or emphasize a little more in academia as well as in practice.
So I'm going to talk about the methods. We are doing a quantitative study. Our population will be downstate alumni who have graduated in the year 2016 or before. Our means of collecting data will be a survey, which will be sent out by email. The questions in the survey will focus on the demographic information of the therapists and their history with addressing sexuality as an ADL. It will also gauge their comfort level with addressing sexuality as an ADL, and all the questions will be close-ended. Moving forward, what we plan on doing is working on our survey questions, as well as quantifying all of the data, hopefully with the help of Dr. Kaplan, and we'll be using all descriptive statistics. And the statistic that we're going to look at is basically the demographics of the therapist, the field they practice in, comfort level with addressing sex, and the demographics of the client.